pregnancy?
Well, there are routine visits through pregnancy for routine patients who have routine pregnancies, but we have to be selective. Not all pregnancies are normal. Patients do have medical problems through pregnancies. Pregnancies are potentially complicated by problems that the mothers may carry, such as high blood pressure and connective tissue disorders and diabetes. And in those cases, the frequency of visits will be upgraded. We need to see patients with complicated pregnancies at more frequent intervals and monitor them more closely so we can make decisions regarding their further management at a closer level. So the frequency of visits will depend on the complexity of your pregnancy. I think it is important for partners to come to our obstetric appointments. I think it's relevant for partners to be able to hear the information that their partner is receiving from their obstetrician, to be able to assess that the pregnancy is progressing normally, and of course to be able to see the pregnancy on ultrasound scan. I think they get a lot of value in actually seeing that things are progressing well, and are also reassured by that, and are also being reassured if things aren't going well, that all the relevant things are being done to make sure that the outcome will be a good outcome. Well, despite living in a wealthy country, the reality is that in many cases patients are deficient in vitamins, and it is important for all patients to be taking vitamins, antenatal vitamins, through their pregnancy. In certain circumstances, however, some patients require even more additives. It is very common, for example, in pregnancy to become iron deficient, so extra iron supplements are a common additional requirement. In certain select cases, especially patients with blood disorders such as thalassemia, they may need to be on extra doses or higher doses of folic acid. It will become apparent as we go through the pregnancy if extra vitamins are necessary, but all patients should be taking the basic prerequisite vitamins. Complex pregnancy care relates to patients who have pre-existing medical problems, patients who have had complicated previous pregnancies, and patients who have complicated past family history that impacts on the pregnancy. In all of these situations, you need to sometimes not only have an obstetrician with a wealth of experience in dealing with complicated pregnancies, but also an obstetrician who can recruit the services of other specialists, including geneticists and physicians, and sometimes even pediatric surgeons. All of these people need to be brought into the picture through the pregnancy in managing complex obstetrics. Fortunately, the majority of women with complex obstetrics can be managed alone by their experienced obstetrician.